It certainly is the woman who, at the end of the day, is paying out of pocket.
It's the Medicare Gender Gap, where women pay significantly more for medical treatment than comparable treatments for men.
The rebate that the government will pay for a woman for her breast ultrasound is less than for a man who's getting an ultrasound on their testicle or looking at their prostate. There's absolutely no logical reason why these differences would exist.
Then there's the ultrasound of a pelvis, which is performed overwhelmingly on women. Despite being more complex, taking more time and requiring more staff, Medicare covers less of the cost than it does for a testicular scan. And when it comes to having a baby?
For an early pregnancy scan, the government has set the rebate amount at just over $36, and that's the lowest scan rebate that there is. If, on the other hand, I was a man who had perhaps a lump in my testicle or needed to have an ultrasound of my prostate, I would be rebated $113. So that's over 3 times the rebate.
The lack of rebates can be found across women's health. Doctors now calling on the government to subsidise the non-hormonal copper IUD.
The IUD that is on the PBS has hormones in it. A patient who's had breast cancer, they wouldn't be eligible because of the hormonal risks on their breast cancer. So a copper IUD would be a suitable or an excellent alternative.
Despite it being one of the most effective contraceptives on the market, women have to pay $110 up front to access it.
People who can't afford to, for instance, go for a copper IUD that has no hormones, it may be that they choose something that is cheaper but has more side effects. They may decide that they can't afford contraception at all.
Once women have paid for the IUD, they need to have it inserted, and the rebate for this doesn't come close to covering the cost of the procedure.
It's something that takes 45 minutes and requires a nurse and equipment. So, the practice may charge anywhere between $150 and $350 for the insertion, and then the patient just gets back $72.05.
As the cost of living continues to bite, unexpected health costs can derail the budgets of many women and families. So, is it time to take the discrimination out of medicine?
We do have gender inequality in medicine still. We all need to acknowledge it, and only then can we take steps to fix it.
I presume this is historical, but it's ridiculous. I mean, I'll defer to the woman on the panel, but I had no idea that those gaps existed. So are they historical?
Yeah, look, the pink tax, it's a real thing, right? I mean, we're already paying more for haircuts and beauty products and clothing, but this seems outrageous when you've got comparable treatments. We're talking ultrasounds, whether it be on a breast or a scrotum. How does a woman pay more for that?
Yeah, I
It's
can't hear
insane.
any good explanation for that.
Why has it not been an issue before, and why has some government in recent times not fixed it?
Well, so the Department of Health gave us a statement, and they say they've established a National Women's Health Advisory Council, and so they're going to provide all kinds of advice, and presumably this sort of thing would fall within it. I just think what would be good for them to do would be to look at the long-term costs. So, for example, if someone opts for contraception that has more side effects because that's covered, and one that doesn't have side effects costs more, what are the costs for all of us later when those side effects show up in other things they need treatment for? Like, I think that sort of stuff just has to be thought through at this point, and I would hope that's what they're going to do.
Hope so.